the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
Hello, all, and welcome to another session of PhysioTV. We have with us a dynamic clinician, Dr. Manasa Nair. She has done her UG and PG in neurophysiotherapy from Sancheti Institute for Orthopaedic and Rehabilitation, College of Physiotherapy. She is a certified aquatic therapist and has a clinical experience of 4 years. She is also the founder of Grey Matters, a venture of physiotherapy which provides solutions for home physiotherapy. We welcome you, ma'am.
So greetings to everyone, greetings to all the viewers. I would really like to thank PhysioTV for giving me this opportunity and to speak here today. Sancheti has been my alma mater. I've done my bachelor's, my master's, everything from Sancheti. So I'm really grateful that I have got this opportunity to address all the viewers today here on PhysioTV. And today I'm going to be sharing my experience as a young clinician in the field of neurophysiotherapy and what are the challenges and learnings that I have experienced throughout this short journey of mine as a clinician. So yeah, I will go ahead and just share my screen so that we can begin the talk. So basically, I'm just going to begin with a short, story about how my journey in these last couple of years have been as a clinician and what are some of the challenges that I have faced. And a lot of you may relate to the same, especially people around my age may have experienced the same feelings. And even if not, I'm sure all physiotherapists who have recently passed out or finished their education have experienced similar feelings. And I'm sure in some way or the other, everyone would be able to relate to this. So basically, my journey began when I finished my master's in 2019 December. And that's when we finished our practical exams. I took a nice break and I went for a holiday with my friends. And the results of my master's came out in February 2020. So February 2020, I was like, wow, I did pretty well in my examinations. I was very excited to start my career and looking forward to the future that was ahead of me. But as all of you know, in March 2020, we had the COVID lockdown. And it was a pretty stringent lockdown, and none of us knew what to anticipate and what shall we be doing and how things will go about. So that led to a lot of feelings of anxiety, of uncertainty, because all the opportunities that were available at that time were more related to COVID duty. And fortunately or unfortunately, I don't know what to say, but I had some people at my home who were immunocompromised, and I wasn't able to take up those opportunities, even though it was a great thing to do. But due to certain restrictions, I wasn't able to take up those jobs. So I was constantly feeling anxious and uncertain, and I was worried that, my career has come to a standstill before it even began. So, and I'm sure it's not just related to COVID. A lot of people who finish their education, and there's that period between you actually doing something, it may be anything, a job, a clinic, whatever it is, and after your completion is where that feeling of really uncertainty starts to creep up, and you get worried that what am I supposed to do and stuff like that. So that's how I constantly felt. And then there was 3 months of stringent lockdown where you couldn't get out of the house at all. And yeah, so I was pretty much homebound like a lot of people were. And in July 2020, I decided, okay, now since the restrictions have been eased down a little bit, I can't go and directly work in a COVID setup, but I definitely want to start utilizing my knowledge. Want to start practicing. So in July 2020, I decided that I want to take up home visits. And that's what I did. I started making small flyers of myself. I started an Instagram page called Gray Matters, and that's where I started putting up content. I made a flyer and distributed it amongst my contacts, and I said that I would be providing home physiotherapy services, especially for neuro rehabilitation. So I started out with one client. Probably the initial month was a little slow. And, by word of mouth, slowly, I developed a pretty good clientele. So that's how I started doing that. And I was very happy with my work. I was feeling satisfied. I had a lot of clients, and that kept me busy. I took all the precautions that were needed. So everything was going well. But there was this constant feeling that, maybe I'm missing out, maybe I'm doing something wrong. Because what happened is a lot of my friends or colleagues at that time were working in a job setup and an employment setup. They were in a hospital or a clinic, and they had a stable job. And here I was doing home visits, and I did not know that maybe sometimes it's possible that you may have clients or you may not have clients, and that stability was not there. And I don't know, I felt like maybe I'm missing out, or maybe I've not followed the classical path of, taking up a job. So is that a mistake? And that feeling constantly kind of kept creeping up. So I spoke to one of my colleagues. She's a very dear friend, and she was working at Aquacentric Therapy at that time. And she recommended that, why don't you join here? And I thought about it a lot, and I felt like it aligned with my goals, is because somewhere deep down, I always knew that I wanted to start my own practice. And Aquacentric Therapy was a startup company at that point. It was a new clinic, it was a new setup, and they were providing aquatic therapy services along with training for aquatic therapy. So I thought I would learn a new skill. I would also learn how to run a clinic which has just newly started up, and I would meet new people and gain more insight so early on in my career. So that's what I did in November 2020. And eventually, finally, in February 2022 is when I decided that I wanted something more. Even though it was great, it was a great experience, I felt like there was something more that I wanted out of myself or out of my career and what I wanted to do in life. And that's when I decided to take a um, leap of faith, and kind of I quit my job at that. So I'm just going to give you a brief overview of how my time was during this period. So during lockdown, like I said, that I started home visits during this time. So we all, like you see, had to take our complete precautions, and we didn't have any equipment, not a lot of help was available at that time. So, this is me making a client, a left-sided hemiplegic client, perform sit to stand. And he was almost a 6'4" or 6'3" tall guy and I'm a tiny 5'2" girl. But yeah, I mean, that's how it was. And we kind of made it work in whatever way. I learned a lot during this period, how to use limited resources available to you to make the best possible therapy. This is another one that you can see. Is I'm asking my client, he's a client with diabetic neuropathy, and I'm asking him to push the heavy sofa set ahead. So whatever was available at that time with the PPE kit, etc., is what we used to kind of do the therapy. So this is during the lockdown period. Following that, I joined aquacentric therapy. Aquacentric was a great experience. I got to meet some of uh, I got to meet some great people and great mentors. I learned an amazing skill, so I upgraded myself in the process of doing this job. And I learned a lot of things that I probably would not have understood if I did not take up this job. So I'm forever grateful for having this experience. So here you can see that I'm performing a technique from a water specific therapy on a child with cerebral palsy. Yeah. And finally, when I left my job in 2022, I decided to go back to the home visit setup, but I approached it a little differently. I I knew that I solely could not provide or cater to a lot of people, and that I always would have limited time, no matter how much I tried. So I looked at it from a different viewpoint, and I tried to build a team where my team of therapists would help me cater to my clients from all around the city as much as possible. So we have a team of like 2 or 3 therapists who help me cater to home visits. So why I did this is just being very candid, is being a young clinician, I did not have the capital to start a clinic immediately. To start a business or run a business, you need at least 6 months worth of savings so that your business is able to survive. So a lot of capital investment was not required in this. At the same time, I could still build a team and basically run a business on my own terms. So that's why I decided to approach it in this way. And I called myself a self-employed therapist, as I am. And this is some of the work that I did while I after I left my job. So this is a client with spinal cord injury. He's a case of cauda equina, and we are making him walk on the treadmill. It's an assisted walk. And another one of the clients that I saw during that time, yeah, she's a client who suffered from quadriplegia, and she also had paralysis of her diaphragm. So yeah, we used all equipment available, and I worked very, very, very hard to cater to the needs of my clients. And currently, I'm also on the medical advisory board, and I work as a consultant for a physiotherapy app as well. And I help them with content editing and creation, and also guide them with respects to the medical aspects of physiotherapy. I'm also a consultant for a company that develops medical braces. So they take my input in designing of those braces and what a medical perspective would be as a physiotherapist. I'm also an aquatic therapist. I actively participate practice aquatic therapy as well, and always as a continued effort to start a rehabilitation center with 5 to 10 employees. And my goal is by the end of this year we should have that as well. So this is just basically a small snippet of my journey till now. And all of these milestones in my 3-4 years of experience have some um, kind of context behind it, and I'll slowly break it up and layer it out for you. So, in general, what is the scope of a physiotherapist after your master's degree? So you can take up a clinical job in a hospital or a clinic. That's usually the most typical kind of path that people follow. And that's completely fine. It's a great way to, learn and interact with new people. And it's not just about the clinical part of it, but a lot of us don't know how to handle the administration part of things, how to maintain proper documentation, and how to time management, how a lot of these things are scheduling of clients. It's such an important thing because you need to manage your time appropriately and schedule these clients appropriately. So these kind of jobs, they teach us a lot of this, which we initially lack. So at a college level, it's very easy. You do go to clinics, you learn a lot of clinical knowledge, there's no doubt about that. But it's like, you go for your 3 to 4 hours in your hospital and you're back. You don't have to really look at anything post that. So when you're in a job and when there's actual reality there, then you learn a lot of things in these settings. You can become an academician in a college. You can take up a job of a assistant professor or lecturer, whatever it is that is offered, if that is your choice of interest. Again, a consultant physiotherapist. Like I said, I'm also on the board of on the medical advisory board of an app. So those are other kind of options. You can go for a few hours at a clinic, or you can be an ergonomic advisor for a corporate company, helping their employees having better posture, ergonomics, etc. You can be a content editor or creator. And like there are a lot of scope of available to us in that field as well. You can be a freelance physiotherapist like I had chosen to be, and you can provide home physiotherapy services and stuff like that. You can start your own clinic, or you can be a researcher. Now, researcher is a long shot out here. You can really try, but it's a great field to be in. And if you do that, then it has a lot of options. Um, Now, what were the challenges, or what are the potential challenges that a young clinician could face who has just completed their education? One of the most common things is that the low pay scale in jobs when you're starting out. So the feeling, the kind of sense that this is what I experience, and again, I'm speaking very candidly, is that you finish your 7 years worth of education. You've really worked very hard. You have a master's degree, and the pay scale that is offered is not usually in proportion to your education or your qualification. So you somewhere feel that, is this right? Am I making the right decision? Is it worth it? And when you compare yourself with similarly qualified peers, you may feel that, why I've worked so hard, why is it that this is the case? But again, this is a demand supply problem in the physiotherapy industry, where the supply is way more than the demand. So, and a lot of people initially, they accept the whatever pay scale is provided to them. So that is something that is up to us that we get to change. But this is one of the factors that really affects young clinicians or physiotherapists when they come out into the real world and they realize these are the pay scale that is being offered. Then another problem is lack of opportunity to do work of interest. For example, I may be a neurophysiotherapist and I want to practice neurophysiotherapy, but sometimes or oftentimes you may not have that opportunity or may not have that option, and that may be a little disheartening. You may not be able to do what you wish to do, and you may have to take up some other opportunity. Lack of professional growth. So there was actually this study done by in Ludhiana by a group of physiotherapists, where they assessed what is the job satisfaction among physiotherapists in Ludhiana. There were around 60 physiotherapists who were recruited for the study. And one of the main things that came up was a lack of professional growth. They felt a sense of complacency in their job. They felt that there was no growth that was happening in terms of professional knowledge, skill development, and even finances. So that's something where they felt that there was a lack or a very slow professional growth. Then if you are working in a setup where you want to generate your own clientele, or for example, in a clinic setup, or in a home visit setup, then generating and converting these clients is not as easy as it seems. How do you keep this flow of clients coming throughout? There will always be some times, where you don't have so many clients. So how do you keep this flow of converting and generating new clients? So that's another problem that a lot of young clinicians face. Like I already mentioned before, is administration and time management. So I am one singular person and I only have so many hours in the day that I can work. And besides that, considering that physiotherapy is also physically challenging, it is not it's not a sedentary job where you sit at the desk all day. So it is tiring no matter what you say. So I only have so many hours in the day. And how do I manage my time to have maximum kind of optimize myself to provide best results to my client as well as to myself? And administration of this, how do I, if I'm working in a self-employed setup, then how do I manage my documentation? How do I manage my payments? How do I manage a lot of that? Is not something that our college, at a college level, that is taught to us. So this is something that you realize after you graduate, and you realize, okay, these are the things that I need to look out for. Another thing is marketing yourself. So everyone wants, no one really likes going and, telling the whole world, I have done this, I have done that, or whatever it is. But how do you market yourself in a way that, again, you are able to get the word out, and at the same time, not basically appropriately market yourself to get the clientele that you want to work with and target the population that you want to target? That's another facet of this, which has not previously been looked at. So this is something you also realize after you graduate. One of the main things is poor financial planning. Is our income usually is lesser than the expenses that we have, and we land up with no savings or no money to reinvest in ourselves or in our business or whatever it is we want to do. And then we're stuck in a loop of continuously. Hello. Yeah. Oh, okay, no worries.
Hi Mansa, sorry yaar, last 2 minutes ka talk I think must have got a little this thing gone off. So we called as soon as we kind of.
Yeah.
So could you just repeat the last 2 minutes ka, if you don't mind?
I think it would probably be this slide itself, right? Any idea?
Yeah, it is this slide only. Yeah. This was the one which was on.
Should I just repeat this slide all over again?
That will also do.
Yeah.
Or you can start from middle, difficulty in generating. And I think you had already spoken about the, I think most of them, I think marketing pe the aap.
Okay, so I'll start from
You
marketing.
can start marketing. Yeah.
Okay, no worries. Yeah. Another challenge that clinicians face initially in their career is how to market themselves appropriately, in a modest way, but at the same time, while still, bringing the word out about their work, because word of mouth is one way that really, really it helps in generating new clients. But how do you appropriately put forth that to your clientele, and how do you target the right clientele? So this is something, again, which I have learned over my experience of how to market myself, and I'm continuously still learning. Then another thing is the poor financial planning. So this is something that I still struggle with, and a lot of therapists struggle with, is that our income is usually lesser than our expenses initially. And then and at the end of the day, the cash flow that we have is that it's in negative or zero at least. So we need to look at ways of how we can generate more income and reduce our expenses so that we have some amount of savings in our account that we can use to reinvest in ourselves or in our professional growth or in our business to further ourselves in our career. So this is something again which is very important. And lastly, but one of the most important things is burnout. um Initially we have so much vigor, so much passion, and we want to do so much, but we tend to burn ourselves out by overextending ourselves or working too hard and not having that balance between our personal and professional life. So, and because we're constantly like, so most of the physiotherapists I know are working at a hospital, clinic, or a college in a job, and at the same time doing home visits as well. And they're working almost 15 hours a day. And when they go back home, they have no time for themselves. And this is possible initially, but at some point, it's not sustainable and eventually leads to burnout. So that's another thing. But I think out of all these things, the thing that affects people most is the low pay scale in jobs. So now there are ways that I kind of tackled this, and I can I will let you know in the further slides. So one of the most important things that I realized is, and this is by Simon Sinek. I'm sure a lot of you would have already heard about it. This concept was introduced to me by my professor, Dr. Gajanan Balirao. And that's when, it provoked some thought in my mind, and I constantly kept questioning myself. So this is known as the golden circle. It's it's made of three parts. And normally when we approach something or some aspect of our life, we usually approach it from outside in. We look at, what do I do? I provide physiotherapy. I'm a physiotherapist. That's what I do. How do I do it? I do it by my skills, that is my ability to provide specific rehabilitation programs, or my manual therapy, or whatever skill that it is that I have. And why do I do that? Because I'm a physiotherapist, or because I want to earn some money. And that's how we normally really approach things in our lives. And no one is really believing that, right? No one's really inspired by that when I say that. Are you inspired when I say that I'm doing it because I'm a physiotherapist? That's not how things work. And what I realize is you need to look at it from inside out. And the three components, that is why do you do what you do, and what's the purpose? What is it that wants you to wake up every morning and get back to doing what you do every day? What is that reason? And how you do it, again, is like I mentioned, it's the skill. What skill do you have? What is your USP? What is your selling point? And it can be anything. It's not necessarily just your physiotherapy skills, but it can be even your people skills, your etiquettes, your manners. People really enjoy those things. So what is it that is your USP, and how do you sell it? Is if you're a great content creator. There are so many doctors now who are on Instagram, and they have like a really good career as a content creator. But if that's your strength, you can create awareness, and that's also impacting something. And uh, what do you do? Like I said, you provide physiotherapy services because you're a physiotherapist. So you create awareness or whatever it is. But when you look at it from inside out, it's more inspiring, and it inspires you to do better every day. So if you know that you wake up because you want to make a difference, you want to help people, you want to create your business, there's something that you do that is inspiring you as well as the people around you every day. That's why you work towards that harder. But if you just do it because I'm a physiotherapist and I want to earn money, then that's not inspiring you or your clients. So have a vision and always have a purpose. A purpose will always help you go further. When we just look at the what part of it, we are constantly in the pursuit of happiness. Like, I do it because I want some money and that will make me happy. But why I do it, that will make you fulfilled. That will make you feel a sense of fulfillment. And that really helped me, because it's not about the money, it's not about the work you do, it's why you do it. And that's the most important thing. So this really helped me. And I think if you adopt this kind of thinking, it will really help you look at the bigger picture rather than what is just happening at this very moment. So yeah, this is something that I learned. And like I mentioned, happiness comes from what we do, but fulfillment comes from why we do it. So another thing that really, shook my boat, it gave me a good reality check, is understanding a little bit about finances. And I'm sure most of you have read this book called Rich Dad, Poor Dad. And this concept is by the author of that book. And this is where it also kind of made me think further um, beyond just, being an employee and being a self-employed therapist. So what this is the cash flow quadrant. And it kind of explained to me is that there are four quadrants. There's employee, where you are working in a job and you are working for someone. And then there's the self-employed quadrant, where you own a job, like similar to what I'm doing. And then there's a business quadrant, is where you have a few people working with you as a team. You have a system of people. And finally, I is the investor, you have your processes set and your money is doing the work. So what this kind of explained to me is that when I am an employee, when I'm in this left upper quadrant of this, um, I can only do so much work. I get money for the amount of time that I give. If I have only 3 hours, then I only get 3 hours worth of money. I can only help three people. That's it. That's where I'm limited at. Beyond that, I can't do it because it's only me. And if I'm on a holiday or if I'm unwell, then those three people are not going to get the work done that they need to get done. And I'm not going to get my, remuneration for those 3 hours because I'm not there. And that is really limiting in a way that you can't take a break. You can't fall ill. Also, you can't help the kind of people that you want to help in that limited amount of time. And to be frank, you can't earn the amount of money that you hoped that you would earn. So then the next one is a little better than that. That is the self. I wouldn't say better, it's just the next step is where you're a self-employed person. Again, it is similar. Um, it is similar to the employment, but it's you have to put in the work where to get the amount of results that you want to see, like the number of people you have. But in this, you own the job. In this, you are not under someone else. It is what you rules and restrictions you set for yourself. And finally is being a business owner. A business owner, how that helps is that you have a system, you have a few people working with you. And now your 3 hours and multiply it by 10 other people, another people's 3 hours, those are the number of people that you can help, the number of people that you can reach in a particular day. So it's not only your active work that is helping, but also passively a lot of the other people's work or time that is helping you grow your vision further. It's helping push your vision further. So in this situation is that it does not, even if you are not there, if you've gone on a holiday for 2 days, your system is in place and your system takes forward your work, and that is what brings you the kind of results that you want to look at. And finally, the last sector is something that I have still not really understood, but I'm constantly working towards that, is how the money that you make or the savings that you make also make up the work for you. Now, basically, what I understood from this whole concept is that there's a concept of active work and passive work. One is active work is the work that you constantly actively have to keep doing. And passive work is the work that keeps happening in the background, but still gives you some financial benefit. So it's always better to have multiple sources of income and multiple sources of revenue, because there may be times where you would not be able to put in that active work. Like I mentioned, physiotherapy is a very hands-on occupation. So there may be a situation. So what do you do in this situation? Always make sure that you have multiple sources of income, and more passive sources of income will always be beneficial. So like I mentioned, active income, passive income, and 95% of the population lie in the left part of the quadrant, that is in the employee and self-employed. I'm in the self-employed quadrant, but I aim to move towards the right side of the quadrant. In this side, there is 5% of the population, and 5% of the wealth lies in the left side of the population, but 95% of the wealth lies in the right side of the population. So my personal goal is to move to the right side of the quadrant, because I can target more people, I can help more people, I can make a difference in more people's life, at the same time helping myself, fulfilling my goals, and earning the kind of remuneration that I hope for. So this is my personal goal. But what I also feel is that it's important to go through the process of this. Because if I was never in an employee position, I would have never understood the mindset of an employee. I would have never understood the mindset of an employer. I would have never understood the challenges that I'm facing. So you can always learn from me or some other mentor of yours, but I feel it's always important to go through the process and kind of have your own learnings from the process. Now, how do we achieve this goal? How do I achieve this goal of having this, um, the system of mine where I can reach more people? So what I have learned is that whatever savings that we do have, is that we must invest it in assets and not in liabilities. Our assets, what are our assets? Is assets put money in your pocket, and liabilities bring money out of your pocket. And your asset can be anything that brings you growth. Okay, now out here, I know it's specifically written money, but anything that helps you push your agenda forward, or anything helps you grow. For example, you can invest in yourself, right? You can invest in doing a course. So I have invested in myself, and this next week I will be going to Hyderabad for my PNF certification. So that is an asset for myself, because I am growing and I am going to help use those techniques to help my clients further and push my agenda further. So that's an asset. You can buy some equipment, for example, a stimulator. That is an asset. It provides, again, it's helping you grow your agenda further. But if you buy a car, that's not really doing anything. So initially, at least I would say, a car, as soon as you buy it, that's kind of depreciating. In any case, it's not really helping you. So look at something that can, initially at least invest in assets that will help you grow further, which will push your agenda, and use that wisely. Set processes for standardization. And what I mean is, like, if you have a system of your own, it cannot be haphazard. It cannot be that you come in and there's no system that's going through. If you look at, for example, McDonald's, anywhere in the world you go to McDonald's, they have the same processes. You go either to the counter or you go to the screen and you select what you like, and that's how you go, and then you pay the money and you collect your order. So those are set processes and you don't need to think. So anywhere in the world you go, you can do that. So setting processes is very important. How do you perform your evaluation of your client? How do you how do you give them an exercise program? How do you document that exercise program? These processes have to be standardized, and once they are standardized, you can replicate them anywhere. So if you want to have a huge system with a multiple number of people, these set standards can be replicated in other situations as well. So that makes your work very easy. And a lot of people, it helps for communication within therapists as well. So setting processes for sanitization is very important. Like I mentioned before, increase your credibility and invest in yourself. No matter what you do, if you don't have or you don't build a credibility for yourself, you will not kind of be able to do the work that you hope for. Only once you have this name that, okay, I have done so much work and people know about your work, that's only when they will come to you. If you don't have that credibility for yourself, it's going to be very difficult to pull the kind of clientele that you want. So constantly invest in yourself and build up your credibility, do good work and showcase that good work. It's very important to showcase that good work as well, because if you keep doing good work but nobody knows about it, then that's not helping you build your credibility. And have multiple sources of income. again, like I mentioned before, is they have to be active and passive sources of income. Like currently, I have multiple active sources of income. Is that where I do my home visits? My team does home visits. At the same time, I do aquatic therapy. I'm also a consultant for a for a physiotherapy app. I'm a consultant for a app which develops medical braces. So these are multiple sources. So if my one source is not doing so well, my other source still covers up for that. But it's very important to have passive sources of income as well. So that's very important. And protect yourself. This is something that a lot of physiotherapists ignore, is always protect yourself, have an indemnity insurance. There are a lot of insurance companies that provide that, because any work you do, that you can never really judge, right? It may not be anyone's mistake, but it might lead to something, and you don't want to lose money or mental peace over that. So have an indemnity insurance and protect yourself. Don't be shy. Like I mentioned before, is market yourself. Market by I'm When I say market yourself, is showcase the work that you're doing. If you have Google reviews for your work, make sure you're letting the world know that this was the review that, or this was the feedback that you got from your clients. It really helps put the word out. You can create Google ads. That is, you list yourself or your company on Google, and that helps reach a lot of people. You can create awareness through social media, which is, I mean, it's a boon actually for us that we have this platform available, and that you can use it positively to create awareness and show the kind of work that you're doing. One of the most important things is raising your standards so that you can elevate the standards of your profession. Like in the study that I mentioned earlier, another problem that physiotherapists faced were that there were a lot of quacks and a lot of people claiming themselves to be physiotherapists, but they were not. And they were charging very poorly for that. And when you are out in the reality, and this is bound to happen, so you raise your standards, and that you charge your price that you feel is, acceptable, and that is, it is, sufficient for you, and that will overall help to elevate the standards of your profession, because there are a lot of quacks who are bringing it down, who will do work for a much, much, much lesser price. But you make sure that you are setting your standards and providing quality work which justifies that kind of remuneration. So make sure that is another thing that you keep in mind. And like I said, finally, having a skill will lead to growth, but having people skills will take you a long way. Half of the problems, like, I mean, a lot of us have had soft skills training when we were in college. So, but how much do we really apply that? Because having people skills will take you much, much, much ahead as compared to just your physiotherapy skills. A person walks in, you give them a nice smile, you ask them how you're doing, and just showing that you're interested in what they are going through, and just leading a conversation in a way that they feel comfortable with you, that will 100% make solve at least 10 to 20% of the problems on the spot. If they are confident in you, they will continue to come to you no matter what. So really work on your people skills, your etiquettes, and your soft skills, and that really takes you a long way. So this is pretty much what summarizes what I have learned in the last few years, and I have kind of jotted down whatever I could that I felt would be most helpful in sharing with you. And I'm sure somewhere or the other, everyone has gone through these things, and I am still continuously learning and growing. At this point in my life, this is my perspective on this, and I'm sure as you meet me a couple of years later, I would have a different perspective or new perspective. So I hope this helped. And I again would like to thank PhysioTV for this opportunity and letting me share my experience. Thank you so much.
Thank you for such a wonderful session. I hope that it will be helpful for our current as well as upcoming clinical therapists. I would also like to thank Dr. Parag Sancheti sir, Chairman Sancheti Groups, and Mrs. Manisha Sangvi ma'am, Chairperson Sancheti Healthcare Academy, for their constant guidance, and Dr. Apurva Shimpi sir, Principal of Sancheti Institute for Orthopaedic and Rehabilitation, College of Physiotherapy, for his constant support, our PhysioTV technical team, and lastly, our loyal viewers. Thank you and see you next time.